Hi, my name is Mary, and today I'm going to be talking about how I would feel about a preterm baby in the NICU and how the parents are very adamant about not saving their baby and not wanting to take the extraordinary measures in order to save their baby, who was preterm and is currently in the NICU for the numerous complications and illnesses, and how the prognosis is also very poor for the newborn. So there are two questions that I'm going to be answering. So first off, I would like to say that as a nurse, it is so important to genuinely care for your patients, young or old. So in this case, it's a preterm baby who was born less than 37 weeks and parents who I assume are older. Being a nurse is not just about knowing how to treat the patients that you have from textbook experience that you've learned throughout nursing school or just real life experience. It is also about having a heart to care for your patients and having the sympathy and the empathy in order to care for them. Now, it's very important to have that because in a very emotional level, you are able to kind of connect with the patients, especially the parents in this situation, and just kind of show them that you care and that you're there for them and you're available whenever they need you, when you are working or whenever you see them. And at the end of the day, like, they remember you from when they get discharged from the hospital and months from their discharge and like years from their discharge, because this was a very emotional day for them. And so they will remember the healthcare workers that took care of them and their newborn baby who was preterm in the NICU. So personally, I haven't had a lot of clinical experience with babies, kids, or their parents, but I can only imagine how tough it is to be put in that position. And as a nurse or even a doctor who works in that field and the NICU specialty, you must have a really good heart to be able to kind of work in that field and care for their parents and their newborn. So they enter this whole cycle of pregnancy and the labor and delivery aspect of it, thinking that their experience will be magical and joyous and healthy for both the mom and the baby. And nobody is really prepared for parenthood in the beginning, let alone a baby in the NICU due to multiple complications. And the mom is probably thinking what she did wrong and doubting herself and just being anxious and scared for her newborn, even though maybe it wasn't anything that she did, maybe it was, but as a nurse, you kind of have to just make sure that she doesn't beat herself up for it, because it probably wasn't her fault, maybe it was, but you just have to be there for them. So the first question is, what do you think your reaction to the situation would be? So if I were to put in this situation as the parents and the baby's nurse, I would ultimately respect their decision. But of course, as a normal human being with feelings, I would be sad for the baby, I would be sad for the parents, and I would just be sad in general, just because this isn't something that anybody should be able to go through. And this is something that nobody would wish upon their worst enemy. I can only imagine how hard it would be to work in a field where you see newborns suffer every day, but it's also such a blessing to have nurses in the NICU who have that heart and the mental capability for that. So aside from being sad for the parents and the baby, which I would be, I would also respect and support their decision, because at the end of the day, they are the parents of their child and they have the ultimate and the complete decision of what they want for their newborn baby. Since I'm not the parent, I'm their nurse, I can't really tell them what to do. And as a nurse, I would support them, talk to them about their decision, answer their questions without being judgmental, because that's the last thing you would want, is being judgmental to a pair of parents and just patients in general, and to show how invested I am in their care and in their choice of not wanting to take the extraordinary measures to save their baby from the complications and the illnesses that he or she have. And the second question is, what factors might affect your reaction? So the factors that can affect my reaction is that it isn't my child, it's my patient's child. And like I said, at the end of the day, the baby is their baby, and I have no say in what they intend to do because it is their child. And I keep repeating myself because I feel like most people in the world in general just like to put their feet in somebody else's shoes and just pretend like they know what's going on. But I don't know what's going on. It's not my baby and it's not my life, so it's not my decision. My reactions would also have something to do with the fact that because the baby has a poor prognosis with many illnesses and complications just coming out of mom, it must already be hard for the parents to make their decision, and they don't need anybody's judgment. Like I said, they expected a healthy baby and they did not get one. So in order to show their love for the baby, they don't want to put their newborn through any more pain and uncertainty that he or she will have through the numerous tests and lab results that they're going to go through, like all the medical treatments that I assume the baby would have in the NICU, and just kind of fighting for their life, essentially. It's not easy for the parents to seal this kind of decision. And another factor that affects my reaction is the fact that the baby isn't my own. I'm emotionally invested in the patient case, of course, but I can't be emotionally connected to the baby just because I wasn't pregnant with him or her. And if I'm thinking that I were in that situation, I would want the nurses to be respectful and courteous and emotionally available for me and my husband and my family and friends, and just for them to ultimately show respect for our choice. So babies don't show pain as well as older adults do. So we really have no idea how they would react to numerous tests and labs and just medical treatments. But one can only imagine how tiring it must be for the newborn to just come out of the womb with a lot of complications already. And it must be very draining and physically exhausting for the parents to continuously watch their baby go through all the hardships just after hours of their baby being born. And that includes like screening tests, labs and test results, and anything like invasive that they may do in order to save the baby. Nobody prepares for this kind of heartache, especially being parents. It's already hard to go through, I guess, as a mom, it's already really hard to go through all the hormones and body changes. And even for the dad, like if they feel the same symptoms as their wife or their partner, it is really hard for him to be watching his partner go through all the hardships that she's doing just to keep this baby viable, and just so she does everything to protect herself as well. And not only is it difficult for the baby, but it's also difficult for the mom, the dad, family and friends, and of course the parents and their whole support system will always be thinking about the day that they decide that they didn't want to put their baby through anything worse. And they're going to be thinking about that like years and years from that day on, because like I said, it's not a decision that they wanted to make. It's kind of a decision that they sought to be better for the baby overall. And they didn't want the baby to be growing up, childhood, middle adulthood, being connected to vents, oxygen for the rest of their lives. They want to give the baby good quality of life. As a parent, you want to do that for your kid. No matter what the situation is, nurses and healthcare workers must respect the decision of the parents, because it's their body, it's their life, it's their child, and nobody should ever get hate from this circumstance, since it wasn't a simple decision for anybody. And for people to give hate to parents who are going through this just have no heart, in my opinion. You shouldn't be hating on people because they decided to do what they did. So that is my discussion about the 2 questions, and thank you.